Recording. And what I'm going to do, Doctor, is I will let you do a little introduction of yourself if you'd like.
Sure, that's
I don't
fine.
know, what your presentation has, and half the time I'll say something and then it'll just be what you're going to repeat anyway. But real quick, everyone, thank you so much for joining. My name is Chad Moore, the CEO of DopaFit Inc. As many of you know, we have our Parkinson's disease movement centers in Massachusetts, and we're also reaching people all over the world with Zoom. And today we have a wonderful presentation that the doctor will get into for us.
Great. So hi, folks. My name's Dan Kremens. I'm a movement disorder specialist based in Philadelphia. I'm a medical co-director of a Parkinson's Foundation Center of Excellence. And I've been taking care of people with Parkinson's disease for about 20 years now. So I've gone on the full journey with a number of my patients at this point. I love to see if you can see the column that has everybody's pictures in it, that you can see they have some photo there of me. I think that photo must be at least 15 years old because I still had some brown left in my hair, which is now fully silver. So I'll have to get them to update that picture at some point. But prior to going to medical school, I was actually a lawyer and I practiced law for about 7 years. So I came to medicine a little later than people, but I think it gives me a little bit different approach to things. So I'm so glad that you've taken time out of your days today to learn a little bit about Parkinson's disease. And specifically, we're going to be talking about understanding off episodes and dyskinesia in Parkinson's disease. And we're going to be exploring the impact of off and dyskinesia in the daily lives and some treatment options for people with Parkinson's disease. Whenever I give one of these talks, I feel it's a little like bringing coals to Newcastle because I'm talking to people with Parkinson's disease about their experience. And I don't have Parkinson's disease. But I hope I've learned a lot from listening to my patients over the year, because I think that's the most important thing we can do as physicians to try and understand our patients. So this is me, and this talk is being sponsored by Adamas today. And I'm presenting information that I've prepared along with Adamas. So what we're going to learn about today, we're going to learn about dyskinesia. It's a term you've probably heard of. So what is it? How can it affect daily life? The impact of treating motor complications in Parkinson's disease, and some treatment options for dyskinesia. So let's talk about some important terms to know about when we talk about Parkinson's disease and movement in Parkinson's disease. So Parkinson's medication, and the main one that we're going to talk about today is levodopa. And you probably take it in a form called carbidopa levodopa, or some of you may know it by the name Sinemet. So, and then there are other therapies, and these therapies are designed to increase dopamine levels in the brains of people with Parkinson's disease. Because if you have Parkinson's disease, you don't have enough dopamine. So levodopa is designed to replace dopamine in your brain as Parkinson's disease progresses. And what can happen is, with time in Parkinson's disease, the brain can have some challenges with regulating the dopamine that you're getting orally or some other ways. And this can result in dyskinesia. So if your dopamine levels are too high, you can have too much movement.
I have that.
And if your dopamine levels are too low, you can have off time. So what do we mean by off time? Off time is when you have return of your symptoms in Parkinson's disease. So this is when the levodopa has dropped to a low level and it's just not working well. And how might that appear? You might be slow. Your tremor might reappear. You might feel more stiff. You might have more problems with balance. It might be difficult for you to get in and out of chairs or in and out of the car. You might have difficulty initiating your gait, things like that. What's good on time? Good on time is when levodopa is at an appropriate therapeutic level in your bloodstream and it's working as expected. And in this situation, that's when your movements would be good. Some of you, if you're lucky, the levodopa can control your tremor. For a lot of people, levodopa doesn't do much for tremor, but what levodopa almost always helps with is the slowness and stiffness associated with Parkinson's disease. So when you have good on time, that's when you're able to move well. You feel good. You can get in and out of the chair easily. You're able to walk easily. You can do your physical therapy, all those things. Your feet aren't getting stuck. And then there's dyskinesia. What's dyskinesia? This is when your levodopa is at high levels and you're able to move, but you're getting extra movement, these involuntary movements that often look like writhing movements, or medical term is sort of choreatic movements, where you might be shifting and fidgety. Sometimes people are described as looking fidgety. And this is distinct from tremor. Sometimes Parkinson's patients have a little difficulty, or their caregivers have a little difficulty figuring out, is the patient having tremor or are they having dyskinesia? I will say one of the good things, there aren't very many good things that came out of the pandemic, but one of the few good things that's come out is the use of telemedicine. Because in the old days, if I had a patient call me up and they weren't sure whether they were having tremors or what, it was a little difficult. But now I can just set up a telemedicine visit and look at them, and I can see it, and they don't have to come down to my office and pay expensive parking in Philadelphia. And so that's been a really neat thing. So this is what I was mentioning before, that dyskinesia and tremor are commonly confused. So tremor is a regular rhythmic shaking movement. It typically in Parkinson's disease occurs in a person's arms or legs, generally when they're at rest. And this typically occurs during off periods. Although for some people, they can be on and still have tremor. Okay, so tremor is one of those things that's a little hard to measure for on and off. But there are some people who take their levodopa, their tremor goes away, the levodopa wears off, and the tremor comes back. That's clearly a measurement of off for those people. But a lot of people take their levodopa and still have their tremor, but they're able to move well and things like that. So dyskinesia is different than tremor. Dyskinesia is not rhythmic. Dyskinesia is sudden, it's jerky, it often looks sort of fidgety, and it will occur even when you're on. In fact, it occurs mostly when you're on, although there are some people who have a rare form of dyskinesia that actually emerges as they're wearing off. And some people, a very small group of people, have what we call biphasic dyskinesias, which are dyskinesias that occur when the patient's off and on, and those can be very challenging. So dyskinesia can impact the daily lives of people with Parkinson's disease, and it can impact it in a number of different ways, including physically, socially, and emotionally. And let's take a look at some of this. So dyskinesia can impact daily routine. So there was a survey that was done as part of one of the trials looking at a medication for dyskinesia, and patients rated what they felt was going on. And they said that their dyskinesia impacted their walking, their ability to do their hobbies, handwriting, dressing, hygiene, and eating. You could imagine, if you're experiencing significant dyskinesia, you're moving, you're doing, and you can't control this, and you're trying to reach out and grab a glass of water or drink on the kitchen or the dinner table, how easily it might be to knock it over when you don't mean to, things like that. How difficult it would be if you enjoy hobbies such as painting or something like that, and you're dyskinetic, how hard it would be if you can't control your hand independent of your tremor just because you're dyskinetic. 73% of patients with Parkinson's disease who were surveyed said, who experienced dyskinesia, said that they felt that their walking and balance was most affected. So it increased their risk of falls if they were dyskinetic. In addition, it has significant social and emotional impacts. So again, similar study showed that 72% of people with Parkinson's disease said that their dyskinesia had a social impact on their lives. In a survey that was done in 2012, 40 people responding said that their main concerns were embarrassment. People would stare at them in restaurants, or if they were out, wondering, why is that person moving that way? They would often avoid family gatherings and events. And sometimes it would create family tension. I see the situation sometimes where the patient themselves aren't necessarily bothered so much by their dyskinesia, but their spouse or their caregivers are. I've had situations where a spouse might say, well, the dyskinesia, those movements don't bother him, but they scare our grandchild. She keeps asking, why is grandpa moving like that? And so even though the patient himself or herself may not feel a direct impact, it can still impact the family and cause tension as well. So how do we manage dyskinesia? Well, there are a number of ways to try and manage it. One way is to try and reduce or otherwise alter the levodopa therapy. The challenge with doing this is that if I reduce your levodopa, or your other medications, it may help your dyskinesia. It may reduce it, but it's also going to worsen your movement. You need that levodopa. You're going to feel slow if I cut the medication. It might make your walking harder. It might increase falls. So also, if I start seeing that you're having some dyskinesia, but you come to me and you say, well, your walking is harder, I might be afraid to increase your medicine even though you need it, because I'm afraid, well, if I increase the medicine so you can walk or get out of chairs easily, you're going to have more dyskinesia. So another way that we can now do it is, now that there is a medication that's approved for the treatment of dyskinesia and Parkinson's disease. And so we can add that medicine to your levodopa. So we don't have to cut your levodopa. We can simply add this medication to allow you to treat your dyskinesia while continuing to be able to use a stable levodopa dose. Another option for the appropriate patient can be deep brain stimulation. Deep brain stimulation can be very effective at treating dyskinesias, in part because with deep brain stimulation, we're often able to reduce the medications without worsening your motor symptoms. So again, this is what I was talking about before, how the most common approach is to reduce or otherwise alter the levodopa therapy. But the challenge here is, if I reduce your levodopa to avoid dyskinesia, that can result in more off time. But if I increase your levodopa to avoid off time, that can result in more dyskinesia. So you end up in this push me, pull you situation where I have to balance, as the healthcare provider, the good on time versus the off time and the dyskinesia. So it can be a real challenge. So one option is to add a medication. So this is the medication we'll talk about a little more today, which is Gocovri. So Gocovri is the first and only medication approved to treat dyskinesia as well as off in Parkinson's patients who are taking levodopa. So Gocovri achieved in the pivotal trials reductions in dyskinesia while keeping the levodopa therapy the same. So I didn't have to reduce the patient's levodopa and make them worse motorically to control their dyskinesia. I could simply add on the Gocovri. So Gocovri is indicated for the treatment of dyskinesia in patients with Parkinson's disease who are receiving levodopa-based therapy. And it's adjunctive. It's also approved as an adjunctive therapy to patients who are experiencing off episodes. So how do you take Gocovri? Gocovri is a really interesting medication, because what you do is you take the Gocovri at bedtime, and then while you're asleep, Gocovri slowly releases over the course of the day. So by the time you wake up in the morning, you have an efficacious level of the medication in your bloodstream, and it stays there throughout the day and then slowly decreases until it's time to take your next dose in the evening. So basically, with one dose, you're covered throughout the following day for your dyskinesia. There's something called the Unified Dyskinesia Rating Scale, which is a clinical scale that we use that's been validated, that we use to rate how bad someone's dyskinesia is. And what they did in the pivotal trial is they gave people Gocovri and they measured how well they did over a certain period of time. And what they found was, at the end of that study, there was about a 27% decrease in the patient's dyskinesia compared to the people who were given a sugar pill or a placebo. In addition to looking at off time and dyskinesia, the medication also was demonstrated to improve good on time. What do they mean by that? That's when your medication is working well and you don't have troublesome dyskinesia or dyskinesia that's interfering with your ability to function. And what they did is they had patients keep a diary over the time that they were awake during the day. And the awake time, you can see here on the left, is this mix of the gray, the yellow, and the green. And what does that represent? The gray represents their off time, the time when the patient felt like they couldn't move. The green is their on time, and the yellow is their time when they're having dyskinesia. And the goal is to try and shift all those different colors basically to green. And what they found, based on the data of the patients in this study, is that the patients who were taking Gocovri versus the patients who were taking placebo improved their on time by about 2.5 hours over the course of the day. They reduced their dyskinesia time by about 1.5 hours, and they reduced their off time by about 1 hour. So they had improvements in all three of the areas that they were looking at if they were taking Gocovri relative to placebo. And you can imagine you have 2.5 hours of better on time and a 1.5 hour reduction in your dyskinesia and 1.5 hour reduction in your off time. That could translate meaningfully into the ability to do things over the course of a day. So just a little bit of important safety information with any medication. So possible side effects of Gocovri, and these apply to not just Gocovri, but almost any medication involved in Parkinson's disease, because we see these in anything with that impacts dopamine in Parkinson's disease. So these include things such as falling asleep. So some of the Parkinson's medications can make us tired, including Gocovri. So I always warn people when they first start it, see how you feel when you start it. There have been some reports, and we see this again with other Parkinson's medications, of the medications causing issues with mood, including suicidal thoughts and depression. So again, something to discuss with your doctor for sure. The most common side effect that we did see with Gocovri in the clinical trial are hallucinations, but most of these times these hallucinations can be managed by adjusting the dose of the Gocovri. Certainly in older patients, sometimes the higher dose of Gocovri is not tolerated as well because Gocovri is cleared by the kidneys, and sometimes as we get a little older, our kidneys aren't as efficient. So you might need a lower dose of Gocovri. So that's something to certainly follow up with your doctor. Parkinson's medications can often make people feel lightheaded upon standing. That's something that we call orthostatic hypotension. So something to discuss with your doctor. And almost all Parkinson's medicines have also been associated with impulse control disorders, including things such as hypersexuality, gambling, compulsive spending, or compulsive eating. So definitely something to discuss with your healthcare professional if you feel like you're experiencing something like that on any of your Parkinson's medicines. The most common side effects that were seen in the clinical trial with Gocovri was dry mouth, swelling of the legs and feet, constipation, and falls. So you want to ask your doctor if Gocovri could be right for you. So it's important to proactively talk to your doctor if you're experiencing dyskinesia or your family members are concerned that you're experiencing dyskinesia. Even if you don't feel it's bothering you very much, it might be impacting your family as well. So something to think about and discuss. So again, tracking your symptoms, recording your symptoms. I love when patients bring a care partner or significant other with them, because a lot of times you can get maybe a little more accurate picture of what's going on in the patient's life. I think having them make notes about what's impacting their daily routine. And there's some information at the website gocovri.com that gives you a guide to discussing things with your doctor if you'd like to use a resource like that. There's a program called Gocovri on Board, and that might be helpful to help you access your Gocovri. So Gocovri is what we call specialty pharmacy medication. So I don't just give you a script and you go to a pharmacy and get it. We have to get this approved for you. And Gocovri on Board can be very helpful to get that approved. And for certain patients, particularly those who have commercial health insurance, they may be able to get the drug for as low as $20 per prescription. And for patients who don't have insurance, or your insurance doesn't cover Gocovri, or the copay is too much for you, there are patient assistance programs that may be possible to help you get the medication at a very low or at no cost for you. Certainly, I've had a number of patients who have been successful getting foundational support to help them successfully get not just Gocovri, but all their Parkinson's medications covered. So Gocovri provides nighttime dosing with daytime coverage. And it's one of the nice things about, maybe making the difference for your ability to get out of bed easily in the morning, then function with less dyskinesia and less off time throughout the day. So again, certain things, you always want to make your doctor aware of if you're taking medicines and herbal supplements, just so they're aware. One thing that is important to know, although thankfully we're getting out of the flu season, but you cannot receive the live flu vaccination with Gocovri. Why is that? The main ingredient in Gocovri is amantadine, and amantadine is actually also an antiviral drug. So it will, if you're taking amantadine with the live vaccine, it will lower the efficacy of the live vaccine. So you can get the regular vaccine, which is the killed vaccine, no problem with Gocovri, but you don't get the live vaccine for the flu. Again, there's the active ingredient in Gocovri, as I just mentioned, is amantadine. So what did we talk about today? We talked about how dyskinesia occurs when your levodopa tends to be at its high level, but adjustments in levodopa might result in a trade-off between your off time and your dyskinesia. So by adding Gocovri, you can treat both your off time and your dyskinesia without having to necessarily lower your levodopa. And it's designed to be taken once daily at bedtime and work throughout the next day. It's indicated as a treatment for dyskinesia and also as adjunctive therapy for off episodes. So you can use it for both. So with that, we've come to the end of the formal program, and I'm happy to answer any questions you have about off time, dyskinesia, Gocovri, or Parkinson's disease.
Great. Thank you so much, Doctor. If anyone has any questions, please put them in the chat. There were 2 questions, but I think they were answered. Someone did ask what's the difference between amantadine and Gocovri. And I think my understanding is that people might just be calling it amantadine when is what they're taking Gocovri, or could they be taking just amantadine?
They are different, and it's important to point that out. So there is amantadine. There's a generic form of the drug called amantadine, and Gocovri is different than that. Gocovri is a very specific form of amantadine. Regular amantadine is a drug that releases instantly. The pharmacokinetics of it, or how it gets into your bloodstream and how it's maintained in your bloodstream, are very different than Gocovri. Gocovri is a proprietary form of amantadine. And what it is amantadine that's designed to release very slowly over the course of the evening. So it gets to much higher serum blood levels, and more amantadine therefore is available in your body throughout the 24 hours. You cannot achieve that with regular amantadine, which has to be dosed 2 to 3 times a day. So they're very different medications, even though their base ingredient is the same.
Great. So if someone's currently taking amantadine now, do you think it'd be a good option for them to talk to their doctor about Gocovri?
Definitely, because although there have not been any head-to-head studies comparing regular amantadine and Gocovri, so there isn't any double-blind placebo-controlled studies where you give one person placebo, you give one person amantadine, and you give one person Gocovri. I can tell you from my clinical experience that in general, I find that Gocovri works better for patients. In addition, regular amantadine, while it has been shown to be beneficial for dyskinesia, it has never been shown to reduce off periods. Only Gocovri has been shown to reduce both dyskinesia and off. So if you're somebody who has some dyskinesia and you're taking amantadine, but you're still experiencing off episodes, Gocovri may be able to help you reduce your off in addition to the dyskinesia.
Great. And then in reference to the, treating dyskinesia and off, very recently they've been able to really state that it clinically that it helps with off periods. Now, does that mean that should someone only be taking Gocovri if they have dyskinesia and then it helps with the off, or is it also being used just for someone who's seeing off periods and not so much dyskinesia?
So with the new indication, if a patient and a physician chose, you could use amantadine for, Gocovri. You could use it as a medicine to treat off as well. But we have lots of medicines to treat off. We have no medicine to treat off and dyskinesia except for Gocovri.
Okay, great. And someone had asked, what is the mechanism that makes Gocovri work?
Well, it's a little bit complicated for those of you who aren't uh, very, very familiar with um, neuroscience, but I'll try and give the simple answer. In the brain, we have in what we call the direct and the indirect pathway. And grossly speaking, the direct pathway is the accelerator in the brain, and the indirect pathway is the brake in the brain. And in a healthy brain, the direct and the indirect pathway are in balance. What happens in Parkinson's disease with the loss of dopamine is that the indirect or brake pathway has too much activity, and the direct or go pathway or accelerate pathway has too little activity. So that's why we slow down. These pathways can be regulated not just by dopamine, but by another chemical in the brain called glutamate. And glutamate has an interesting property in that it works differently depending on when the dopamine status is high or low. So if your dopamine is low, you are off. And what glutamate will do is it will make you more off. If your dopamine is high, that means your go or your accelerator or direct pathway is too active. That's where you get the dyskinesias. And glutamate in a high dopamine state actually makes it worse. So it's paradoxical. In a low state, it makes you slower. In the high state, it makes you faster. And what Gocovri does is it regulates glutamate. It helps block the receptors for glutamate. And so if you block the receptors for glutamate, when dopamine is low, the glutamate can't make you slower. And when dopamine is high, the glutamate can't make you more hyper. So that's how we think amantadine works. So it's a little bit complicated because it involves multiple pathways.
Very good. Thank you for putting that in terms that all of us could understand.
I hope
sure
so.
wasn't too easy. The gentleman who asked the question did say thank you for a clear explanation. So, so very, very good. One person asked, how is Nupro different from Gocovri? And I know Nupro is generally used for restless leg syndrome.
So Nupro is indicated for restless legs, but it's also indicated for Parkinson's disease. Nupro is, so there are different types of medications. There are different classes of medications. Nupro is what we call a dopamine agonist drug. Dopamine agonist drugs are drugs that look like dopamine to the brain. So they trick the brain into thinking it's getting more dopamine. So that's why we use Nupro. Nupro does not help with dyskinesia. Nupro can contribute to dyskinesia, but the risk of dyskinesia with dopamine agonist drugs tends to be lower than with carbidopa, levodopa.
Great. And so someone asked, has it been medically determined that increased levodopa level is the sole cause of dyskinesia in Parkinson's patients?
So that's a really great question. The answer is we don't know. In the old days, it was we would have said, oh yeah, it's just related to high doses of levodopa. But we now understand that dyskinesia is probably far more complex than just high doses of levodopa, because we now know that people can get dyskinesia actually at relatively low doses of levodopa. And it is probably more related to how long you've had your Parkinson's disease rather than your levodopa dose. Now, there's no doubt high levels of levodopa can contribute to early development of dyskinesia. There was a famous study called the L-DOPA study that demonstrated that levodopa worked in a dose-responsive fashion, meaning The more levodopa you got, the better you did motorically. But what they also found in that study was people developed dyskinesia faster at the higher doses. But there was a much more interesting study that came out recently that looked at a population in Africa where in the country they didn't have much access to Parkinson's medicines, including levodopa. And they compared the population to a group of Italian citizens. It was an Italian study, and what they found, where you had lots of access to Parkinson's medicines, including levodopa, and what they found was that the African population developed dyskinesia very quickly once they were introduced to levodopa. So it wasn't the length of time or the dose of the levodopa that they were on, because these were people who had Parkinson's for 7, 8, 9 years and just had never been treated. And what happened is, as soon as you started treating them, they developed dyskinesias very quickly. So based on that study, because we don't have many populations in the world that don't have access to levodopa, we started to realize maybe it isn't the dose of the levodopa or how long the people are taking levodopa for, but how long the person has had Parkinson's disease that really increases the risk for dyskinesia. So the answer to your question is we don't know. There's this intriguing new paper, and that paper's a couple years old, and so we're really looking into that.
Very good. And I think that's kind of the, in my experience, the age-old question with dyskinesia. Is it the longstanding use of the carbidopa levodopa, or as you're now saying, due to those studies, that it could just be it could be living with Parkinson's disease for that long? A lot of people will reference Michael J. Fox, and he is a very dyskinetic at this point, and oftentimes it had been pointed to, they believed that it was the longstanding use of carbidopa levodopa, which has, and again, in my experience, people have said it has stopped them from taking carbidopa levodopa. So from what you're saying and what that study is that it might not necessarily be the carbidopa levodopa that is causing the dyskinesias. It would just be living with Parkinson's disease for an extended period of time.
Well, yes, but you have to be exposed to some dopaminergic medicine, right? If you never have take carbidopa levodopa, you'll never be dyskinetic. But okay, the question is, once you take carbidopa levodopa, do you inevitably develop dyskinesia? And is it a result of the drug itself, or is it a result of having Parkinson's disease and the brain not able to regulate the way that we currently deliver dopamine orally? And so it's really a complicated question. I think the thing to point out about Michael J. Fox, too, that people have to remember is Michael J. Fox has been taking levodopa for 30 years. And he writes about in his book how, when he was early diagnosed and he wasn't in public, he was taking huge amounts of levodopa to try to control his symptoms so he could remain, hidden and asymptomatic and stuff like that. And so, 30 years later, when you pay a price for taking very, very large doses. We learned that from the L-DOPA study. If you take really large doses of levodopa early on, that will increase your risk of dyskinesia for sure. But
wow, great.
Levodopa is the best medicine there is for the treatment of Parkinson's disease. And I don't think that anybody should delay their treatment of Parkinson's disease out of a fear of dyskinesia. First, because levodopa works the best for Parkinson's disease. Second, we now have medications approved like Gocovri that we can use to treat dyskinesia. And third, if necessary, we have deep brain stimulation. So I think obviously each patient is different, but in the vast majority of patients, the benefits of levodopa or some therapy outweigh the notion of, well, I'm just going to wait until I absolutely need it. Because by then, all you've done is you've missed the time period when the drug would have worked the best for you.
Very good. I'd like to end it there, but before we end, just one more question, because that was fantastic. Thank you so much for speaking on that. It's important for, I think, a lot of people to hear. Sure. If someone does believe they're experiencing dyskinesia, how do they approach their doctor about possibly getting a medication like Gocovri for that? What do you feel as a doctor is the best way for a patient to ask a doctor, hey, this is something that I might be interested in?
You know, I think it sort of depends on the doctor. I'm a pretty responsive doctor to my patient's needs. If a patient tells me, "Hey, I'm experiencing this symptom, and I heard about this medication," you know, as long as the patient doesn't have contraindications to the medicine, there's a pretty high likelihood I'm going to address the patient's concerns and probably, let them try the medicine that they're interested in. I think the if you have a physician who is a little more reluctant for some reason, I would explain the impact that it's having on you, because maybe he or she doesn't appreciate. They look at you and they say, "Well, you look fine. It's only a little. You're just moving a little bit," and he or she doesn't appreciate. Well, that little bit of movement is keeping me from doing my drawing that I like to do, or interfering with my ability to putt on the golf course, and it's frustrating for me. Or I don't like the fact that my grandchild keeps commenting, pop up, "Why are you moving?" and things like that. So maybe the doctor doesn't care that much, but I do. And I think if that's the case, you just need to tell your physician, this is something that I know it doesn't necessarily look that bad, but it's bothering me and I'd really like to treat it.
Perfect. Well, doctor, thank you so much. That was a wonderful presentation and great question and answer session. Really appreciate you taking the time out of your busy day. And for those of you that weren't on the call earlier, that picture behind the doctor is actually taken by him on the golf course. So a beautiful rainbow, in fact, and thank you. And he said that he uses it because he feels it is a positive scene and sends a positive message. So thank you so much, doctor. And I hope
Exactly.
we didn't take up too much of your time so you can get back on that golf course.
Nah, back to seeing patients. It was it was great, and I really appreciate it. And I think that everybody on the call is a wonderful example of how important it is for Parkinson's patients to be proactive and to learn about your disease. And whether Gocovri or not is appropriate for you or something really doesn't matter. In my opinion, it's the fact that you're taking the time to learn about your condition, and I just think stuff like that is just really empowering. And I'm thanking you also for sponsoring this. This was a really great program, and I appreciate all the good questions.
Fantastic. Thank you so much, doctor. Everyone,
Take
take
care,
care.
folks.